So now I'm delighted to invite our speaker from Thailand, Bubpha, and I'm a great fan of Thai culture because in Thai culture you don't actually have to pronounce the second name. This has nothing to do with the complexity, but we adopt different cultures here. Bubpha is the head of biotechnological research, law research at the National Center of Genetic Engineering and Biotechnology in Thailand. She's an expert in IP rights, but also in plant variety protection. I think that's also another interesting dimension that we've heard mentioned a few times downstairs, and again there may be learnings that we can apply from there as we try to go forward together. Her main focus of work is on the regulations related to access and benefit sharing on biological resources, and we're very pleased to have the benefit of her vast experience in collaborations.
Thank you, Andrew. You hear me all right? Okay, thank you very much, and thank you, Chair and IFPMA, to invite me here to share the experience of doing access and benefit sharing collaboration, or actually the collaboration in Scientist Biotechnology Institute under the regime of CBD and in the future Nagoya Protocol. So, excuse me, please. Right, okay. Just today I would like to tell you about the experience in biotech, and to make this view I will divide my presentation. Firstly, I would like to introduce you to Thai biodiversity and just briefly to tell you about access and benefit sharing law in Thailand. Then I would like to introduce BIOTEC. I'm sure that some of you might not know about this organization. And then I'll just talk about the experience of collaboration under the access and benefit sharing regime in BIOTEC before I come to the conclusion. Right, yes, that's a map of my country. This is just show, because if you know this, the country is situated in the tropical zone, and we have a very nice climate, 3 seasons, hot, hotter, and hottest. And with this global warming, plus wet, wetter, and wettest. If you heard like 2 years ago, we have a big flood. So no wonder we have a rich biological diversities. And this is just show you in every region. And the picture showed just, well, basically our, in biotech strength that we have, our strength is in microbes. And then we go to those sources, you know, in the national park and pick some of the sample, and then we just screen some microbes and basically insect functions. And of course, because we are rich in biodiversity, and access and benefit sharing and the emergence of the CBD is a big issue in our country. And this is to show you the overview of the development of access and benefit sharing rules and regulations in Thailand. In 1999, at that time we didn't become the member to the CBD yet, but we enacted actually 3 pieces of access and benefit sharing law. First one was the Thai Plant Variety Protection Act. If you are working in IP in the IP area, you would see that that's an IP law. But actually, yes, this is an IP law, and in Thailand we have like a hybrid law. On one side is the IP, protecting new plant variety, and the other, in the same act, is the access and benefit sharing law in the same act. And the other one is the protection and promotion of the Thai traditional medicine. And the other one, both are acts. And the other one is just a regulation, the ministry rules and regulation. I didn't put on that one. And then in 2004, we just ratified the CBD, become a member to the CBD. And then 2011, just several years past, we just enacted the new regulations. This is because Thai Plant Variety Protection Act, just we deal with just only plant. And now we have another draft on animal, access and benefit sharing animal. It's not yet become an enactment. And that is under the Department of Livestock and Development. And then we miss one type of genetic resources or biological resources, which is microbes. And that's why the National Focal Point, which is the Office of National Environment Policy and Planning, just launched this Regulation Act to cover the microbes. And then we just signed to the Nagoya Protocol. And because, as I told you before, that we are developing countries that focus on, have a lot of biodiversity, so ABS is quite a big issue in our country. Many departments try to develop access and benefit sharing law that complies to the CBD. So in the future, we expect, I think we expect more access and benefit sharing rules and regulation in Thailand. And I would like to introduce you to BIOTEC. BIOTEC, the real name is the National Center for Biotechnology and Genetic Engineering. This is just a government agency focusing on doing research and development. We established in 1983, and later we established the National Science and Technology Development Agency, which we have different national research and development center under this. I can show you this. Yes, we have like BioTech, MTech, NECTech, NATech. Each tech focus on different technology. BioTech focus on biotech, MTech is material science, NECTech is for software, and nanotech is nanotechnology. The core function of BioTech is doing research and development. We hope to contribute this to the advancement in Thailand and well-being of Thai people. So apart from strengthening our research and development skill, we also do technology transfer. We would like to transfer technology that developed in the National Center to industry, to other organizations that may need. And we hope to be an ASEAN Biotech Research and Development Center. We also build infrastructure because we are national center. And one thing we also do is to do HRD, to do human resource development. And to achieve that, we do a lot of research and development, do a lot of collaboration, and we do a lot of training. This is just a picture to show you, because as I told you that now BIOTEC was established in 1983, our strength is in microbes, and particularly insect fungi. This is the picture of insect fungi found in Thailand. We had a lot of species, strains, like that. And for example, like this one, just come from national park nearby to Bangkok, and we have expertise in screening, developing, and collecting these a lot of insect fungi. I think we are the biggest collection of insect fungi in Southeast Asia. And apart from having these biological resources, we still have skill in doing some compound screening, and we have scientists specialized in that. And this is our strength. This is just to show you that some compound extract and compound that our scientists did that. And because as I told you that we are Biotech Research National Center in Biotech, so we cover many in biotech research, ranging from agriculture, food, bioresources, medical, and now we have genome institutes. And we do basically from the beginning, from collecting things, and then we just do the research, and then try to have value added products. That's what we want to do, the whole process. And as I told you that, one thing that we do apart from doing in-house research, one thing is to do collaboration with not just among biotech and the university in Thailand, university outside, and companies outside globally. One collaboration is with Novartis. This happened in 2005. Actually, that was done in 2005, but actually the process started in 2002, I think. I heard my boss said. If it's right, yeah. Before that, yes, we flew and we talked before we finalized in 2005, and it was quite a success because okay, this collaboration is just to focus on finding the potential use of microbes that we have, because as I told you, we strength in these microbes, and find natural compound as a source of potential new medicine. And this collaboration just getting on from 2005. That was the first phase, and now we are in the third phase, which will be end in 2014. So why we have this collaboration? If you look at the title, I put it as an equal partnership, because we have our strength, we have our expertise. But of course, we have some expertise and we would like to gain some more expertise, which we don't have. And fortunately, we know that Novartis have. So that's why I said it took years to negotiate that, okay, we have these piles of microbes. But what we don't have, we have but very limited, is the expertise in picking the compound. Thinking that you have like thousands of microbes, thousands of insect fungi in your collection, but you don't know how to use them. This is what we don't want it to be. It's no point to have loads of biological resources, but you don't know how to use them. So as a research organization, we would like to make use of them, and our objective is just to contribute to the country, to contribute to the research and development society. So what we have is diversity of microbes in Thailand, and we have expertise in screening, isolation, what we do with pure compound. And as I told you, we don't have expertise in picking the compound. We don't have the expertise in which one is working, which one we should do. So that's why we come with Novartis. And with Novartis, we contribute that one, and we ask for the expertise from Novartis. Apart from research fee that we got from Novartis, we have a technology transfer from Novartis to train. I remember that where in 2003 or 4, I read through the contract that we start, and on the table I asked my boss, what did you want? And she said she wanted expertise from Novartis that she didn't have and we didn't have, and in Thailand actually nobody had, because as developing country, we all know that developing drugs is not our expertise, and it's just have to admit that it's quite far because of the technology, because of we don't have people, the skilled people. And because as a national center, we're really keen on that, because we hope that we can use this skill to do some like the disease that international company don't want to do, like malaria or dengue virus. So my boss told me, okay, we would like to get expertise in how to pick the compound, how to know which is the active compound, and how to extract that. And I said, okay, can we get it somewhere else? She said, no way. We can get it only from pharmaceutical company, and a big one like this would be very useful to us. And then that's how we start negotiating that, okay, could you please give us this expertise? And then it comes up, yes, we have technology transfer from Novartis in this collaboration. The technology transfer came in the form of internship. We sent our researchers to be in Basel, and I heard from Frank that now one of our researchers is in America, which is very difficult to get there, but finally we get one of us to there. And some seminar held in Bangkok, and they sent some experts, and they have a lot of like steering committee asking for consultants, and that's very useful to biotech. So what do we have? What do we get from this collaboration? Of course, one thing very obvious is the capacity building for technology transfer. We have, I had a chance to talk to researchers who came to this internship, who received this expertise and technology transfer. They all said that it's very useful, and we gain some skill we wouldn't be able to if we hadn't had collaboration with Novartis. And all of them said that Novartis people are very honest to us. They really teach us what to do, and they really can. Although the technology in Novartis is far, advanced comparing to what happened in biotech, but they said they can adjust that and to suit the work. And what would be the outcome is that we come up with developing two screening methods, two screening technique that now we can put in our service to service the people in our country. And one thing that I think is quite huge in my biotech is that we gain expertise in actinomyces and myxobacteria, which we didn't have before. And we have expert in that and one PhD in that. And now I can say that biotech has the best expertise in actinomyces in the country. And what surprised me is that I know that we finally accumulate more strains, like 6,000. Because you may think that, okay, have collaboration, we give them some microbes and then that's it, out of our stock. But in fact, having this collaboration, we gain expertise to gain more strains of microbes in our collection. And we gain more expertise in technique to use that microbes. So I think this is very, very benefit. And one more thing that our researchers just really love is just Novartis people just give us the consultation, because sometimes you plan the direction of research. If you are a researcher, you know that. And we ask them what you think, and they just give them the opinion. And that opinion is really valuable to us, because the researcher come to think about that because they are experienced and they are in industry. And then they adjust the direction of the research, and they are very useful. So this is what we gain. And about Novartis, I think you have a more compound, diversity of compound with 7,000 to 7,000 something and 100 something compounds, which I'm sure that Frank will elaborate more on that. Right, how we get that? Yes, this collaboration just happened after the era of CBD, which is a very huge issue in developing countries. It's an equal partnership. As I told you in the very early slides, that we have strength in microbes, in screening, and we have lots of microbes, but we don't know what to use. We don't know how to use that. We don't know which technique we should use. Then we, as I said, we negotiate from that. And the mechanism that make this collaboration success is a bilateral agreement. We come and talk. As I told you, it is not like 1 day and 1 month, and then that's it. The contract finished. It took years to finish this contract, and this is just really based on the principle of the CBD, mutually agreed term. Then I'll come to the conclusion. What factors makes this equal partnership? I'm sorry, I missed something, yes? Okay, what I would like to say is that biotech doesn't have collaboration with Novartis only. We have, yes, a slide just missing. Okay, that's fine. I would just like to say that we have collaboration with other companies as well, like Novozymes, Shiseido, and even Japanese government, the National Institute of Technology Evaluation. So we use the same strategy. We share, it's an equal partnership. We share our expertise, and both of the parties gain from this collaboration. Like in Novozymes, we exchange expertise in screening enzyme, which is one of our lab in biotech. In Shiseido, we exchange collaboration in screening something like cosmetic active ingredient, because Shiseido is one of the cosmetic company. And in Night, we share experience and benefit sharing about the expertise in culture collection and things about microorganisms. So what makes this success is, one thing is an equal partnership, but more important thing is the organization's vision and policy. As I told you before, in my organization, our executives said it's no point to just look at, oh, we have much more biological resource in our culture collection, but we don't know how to use that. So they try to find a way. So how can we earn or benefit from using those? So this is just the vision, because I talked to some Thai organization. Some said, no, we're going to protect that. I don't want foreigner to get access to that. So it's just the vision, it's just the policy of the organization. And of course, we have to have expertise. And one important thing to have this kind of collaboration is you have to trust each other. This is what my executive always emphasize. You have to trust them. You try them first. And if it doesn't work, you just stop. But if it works, like in Novartis case, I can say that this is the most successful collaboration between biotech and among the collaboration we made in biotech. And one thing is, the country should have very simple access and benefit sharing rules and regulation. As I told you before about the access and benefit sharing rules and regulation in my country, it's getting more and more. And ABS rules and regulation really have effect to researchers, particularly domestic researchers, local researchers. And if you get more and more rules and regulation, researchers, they have one nature that they don't want to do anything except research. So if you have very strict rules and regulation in ABS, that just discourage research and development. And that would discourage the advancement in science tech in the country. So maybe that's all for my presentation. Thank you very much.